Welcome to our first webinar of the Healthy People 2030 webinar series, which we've entitled Bridging Healthy People 2020 and Healthy People 2030. I'm Rear Admiral Paul Reed, the Director of the Office of Disease Prevention and Health Promotion within the U.S. Department of Health and Human Services, where we manage the Healthy People Initiative. I have the pleasure of getting to introduce our distinguished speakers for today's webinar. If we could just have the next slide, please. Following my welcome and a few opening remarks, our first speaker will be Dr. Brian Moyer. Dr. Moyer is the Director of the National Center for Health Statistics, or NCHS, which oversees the data in healthy people and continuously is responsible for monitoring the nation's progress toward healthy people targets using data from more than 80 different data sources. Following Dr. Moyer's remarks will be Dr. Irma Arispe. She is the Director of NCHS's Office of Analysis and Epidemiology. And we're looking forward to her presentation that will focus on the Healthy People 2020 final review, the quantitative end-of-decade assessment of the nation's progress toward achieving the Healthy People 2020 objectives and goals over the course of the past decade. And then lastly, Carter Blakey, the Deputy Director of the Office of Disease Prevention and Health Promotion, and who I always refer to as the Healthy People Authority, will present on our current iteration of Healthy People 2030, emphasizing how we build upon decades worth of knowledge. Throughout today's presentations, please don't hesitate to submit any questions you might have into the Q&A box, as we will have a moderated Q&A at the end of this webinar. Next slide. So with those introductions, I'll repeat that it is my pleasure to welcome you to the initial webinar for the Healthy People 2030 webinar series. HHS launched this decade's iteration, Healthy People 2030, in August of 2020. And since the launch, our office, ODPHP, has been working with federal partners, states, communities, various organizations, and others toward action, leveraging healthy people and bringing our nation to better health and well-being. Over the course of this current decade, we are looking forward to bringing to you data, information, and resources that will drive change and move us closer to our Healthy People 2030 targets. The focus of today's webinar is looking back at our areas of achievements as well as areas needing improvement from the Healthy People 2020 decade, so we can build upon what we have learned from these strengths and challenges. As the nation emerges from the COVID-19 pandemic, we have learned over the past 2 years that healthy people can provide a foundation on which to frame an approach to recovery that has the potential to yield a more equitable and resilient nation than existed before the pandemic. The next slide, please. As I briefly mentioned, the Healthy People Initiative is managed by HHS's Office of Disease Prevention and Health Promotion, with the Centers for Disease Control and Prevention's National Center for Health Statistics serving as the statistical lead. And since 1980, HHS has released at the beginning of each decade a new set of science-based national health objectives with 10-year targets that are meant to help us all focus on and strive to achieve by the end of the decade. Healthy People underpins HHS priorities and strategic initiatives and provides a framework for prevention and wellness programs for a diverse array of federal and non-federal audiences. Many state and local health departments, non-governmental organizations, businesses, and even other countries draw on healthy people to develop their own health promotion plans. And while Healthy People is led and managed at the federal level, it really is user-driven. It represents collective input from federal, national, state, tribal, territorial, and local levels, including public and private stakeholders. And although the initiative's mission, vision, and goals have evolved over time, Healthy People has remained dedicated to addressing the social determinants of health, improving the nation's health and well-being, and advancing health equity. Next slide, please. As Healthy People has evolved over the decades to reflect the most current science and address the latest public health priorities, it has intentionally strengthened its focus on health equity. Healthy People defines health equity, as you can see here, as the attainment of the highest level of health for all people. And achieving health equity requires valuing everyone equally, with focused and ongoing efforts across society to address avoidable inequalities, historical and contemporary injustices, focused on the social determinants of health, and with the elimination of health and healthcare disparities as the ultimate goal. Healthy People 2030 can be leveraged to make strides towards health equity. Healthy People offers objectives, data tools, evidence-based resources, frameworks, and definitions to promote action toward attainment of the highest level of health for all people. And it serves as a rich and comprehensive data resource, and through its data reporting, provides transparent and timely assessments of progress. We learned firsthand from the COVID-19 pandemic that data availability and tracking is critical for identifying disparities so that we can act collaboratively to improve health and well-being for all. And the CDC's National Center for Health Statistics leads the way in this regard with accurate, relevant, and timely data for healthy people. NCHS's commitment to healthy people provides the public with access to timely data on critical public health issues. So with that, I would like to turn it over to Dr. Brian Moyer, the director of NCHS, to give some remarks with emphasis on the modernization of public health data. Over to you, David. Or Brian, excuse me.
Thank you very much, Admiral Reed. So good afternoon. I'm Brian Moyer. I'm the director of the National Center for Health Statistics, and I am very pleased to be here this afternoon to tell you a little bit more about NCHS and to highlight a few activities that are helping us transition healthy people to the new decade. Next slide, please. So to kick things off, let me give you a little background about NCHS. We are one of 13 primary statistical agencies within the federal government and the only principal statistical agency within HHS. We compile, analyze, and disseminate information for statistical purposes, such as describing population health characteristics and trends, planning and monitoring public health programs, and conducting research and evaluation on health-related topics. We use information from surveys, censuses, government administrative records, and private sector data sets, including a growing number of big data sources, things like electronic health records. While we provide critical information for policymakers, as a statistical agency, we don't advocate policies or take partisan positions. In our role working on the Healthy People Initiative, we provide statistical guidance about how to best use data for policy purposes, drawing on our experience with developing health-related indicators and monitoring them over many, many decades. NCHS prides itself on promoting timely, accurate, and relevant statistical information to our stakeholders. We're also committed to being transparent about our methodologies and statistical practices. Next slide, please. NCHS recently published our strategic plan for the years 2022 through 2025. The plan sets out goals and objectives for NCHS, including areas that tie directly to the Healthy People Initiative. For example, the plan includes objectives to harness new data sources and new data science techniques that will allow us to produce more timely and granular data. This will be instrumental in better understanding health equity and health disparities. The plan also includes expanding our current data linkage program to better understand social determinants of health, linking our current survey data to administrative data, for example, data from the Department of Veterans Affairs or data from the Department of Housing and Urban Development, will allow us to better understand the drivers of health conditions in certain subpopulations. And of course, the strategic plan also includes continued outreach to our data users and partners to better understand the changing public health landscape and to keep our statistics responsive to policy needs. Next slide, please. As many of you know, CDC, our parent organization, recently embarked on a major data modernization initiative. The COVID-19 pandemic brought to the forefront the need for a more modern, integrated, and real-time public health and surveillance infrastructure. And the CDC Data Modernization Initiative is building such an infrastructure. NCHS is a key player in this initiative. Many of our data collection efforts, as well as our data analysis and dissemination processes, are being modernized. We're making enhancements to things like data standards, interoperability, and data access, as well as new cloud-based platforms for hosting and disseminating our statistics. Next slide, please. So, what does all of this mean for NCHS's role and contribution to the Healthy People 2030 initiative? Our new strategic plan goals and objectives, along with the data modernization initiative, will greatly improve our contributions to the Healthy People initiative. The end product will be more data, more often, for a greater number of subpopulations. We'll be able to process and disseminate data faster, allowing for continuous reporting throughout the decade. We'll also be able to provide customizable dynamic data tables and data visualizations that are responsive to a broader set of users, from academic researchers to public health officials to policymakers. And of course, as a statistical agency, we're committed to privacy and confidentiality and will work to ensure that disclosure risks are minimized at all points along the way. So looking forward, there's a lot more to come. We've made great improvements to Healthy People over the past 10 years, and we expect many more improvements in the coming decade. Now, I will turn it over to Irma Arispe, Director of NCHS's Division of Analysis and Epidemiology, to review our achievements from the Healthy People 2020. So Irma, over to you.
Thank you, Brian, and thank you, Admiral Reed. Good afternoon. My talk this afternoon focuses on the Healthy People 2020 decade that just ended, and I'll be sharing some final review resources with you. Next slide, please. Healthy People 2020 was launched in December 2010 and included about 1,300 objectives that were grouped into 42 topic areas. Could I have the next slide, please? Or maybe it just didn't switch on my, maybe my connection is difficult, but there we go. Oops. Go back one. Thank you. So as I was saying, Healthy People 2020 was launched in December 2010 and included about 1,300 objectives that are grouped into 42 topic areas. Of these, a little over 1,100 were measurable, meaning that they had at least one data point during the decade. 985 objectives had 2 or more data points, and we refer to these as trackable objectives. Leading health indicators are a subset of Healthy People objectives, and they're selected to communicate high priority health issues and actions that can be taken to address them. The LHIs included 26 Healthy People 2020 objectives, organized under 12 topics. Finally, Healthy People 2020 has 14 cross-cutting summary measures of health, which are known as foundation health measures. These are used to monitor changes in overall population health. Next slide. The Healthy People 2020 Final Review is a suite of products that evaluates how these objectives fared in meeting their national targets over the decade. It also examines how disparities in the objectives changed during the decade. The final review components were released on a rolling basis, beginning with the end of decade snapshot. I'll review how you can access these materials at the end of my presentation, but I'll start by going through each of the final review products. Next slide. The first product released was the Healthy People 2020 End of Decade Snapshot. It was released in October 2020 and is designed to provide a high-level summary of the progress made toward achieving Healthy People 2020 targets. It includes an at-a-glance overview of the Healthy People 2020 initiative and all of the tools and resources that were made available through the decade. It provides an end-of-decade progress summary of measurable and trackable objectives for the 42 topic areas. For population-based objectives, progress is shown for the total population and for 6 population subgroups, and I'll talk a bit about those later in the presentation. The end-of-decade summary also includes a focused review of progress for the 26 leading health indicators. Finally, the report includes data tables for the summary and a brief, high-level summary of key changes from Healthy People 2020 to Healthy People 2030. Next slide, please. This slide is an example of some of the results you'll see in the Healthy People 2020 End of Decade Snapshot. Could I have the next slide, please? Um, so I'm looking for the slide that has the Healthy People 2020 end of decade snapshot overall progress. So it's a chart. It's a two-sided chart. And on the left side, it has the breakdown of objectives by their status. I think we're still not looking at the correct slide. There we go. That's it. Thank you. Okay, so this is an example of some of the results you'll see in the Healthy People 2020 end of decade snapshot. On the left, you see the breakdown of Healthy People 2020's measurable objectives. And as I mentioned, 985 of them, or about 89%, are trackable objectives that are the basis for assessing progress over the decade. Trackable objectives have a baseline value and at least one follow-up data point and a target value. Progress is summarized into 4 categories: met or exceeded the target, improved, showed little or no detectable change, or got worse over the decade. Overall, nearly 55% of trackable objectives either met or exceeded the target or improved during the decade. A little less than a third showed little or no detectable change, and about 14% got worse with respect to meeting their Healthy People 2020 targets. Overall, about 25 topic areas had 50% or more of trackable objectives improve over the decade. You can find more detailed information on the status of objectives by topic area in the data tables section of the end of the decade summary. Next slide, please. Could I have the next slide, please?
Irma, this is Paul. I just want to step in and say, I think what you're seeing is lag behind what the rest of us
I
are
see.
seeing.
Okay, I'm sorry. I apologize.
Yeah,
Then I'll
no, it's
just,
okay.
I will
We're
act on faith. And I'm sorry, it
yeah,
must be my internet connection. Thank you,
yeah.
Paul.
Okay.
Okay, this slide shows the final progress status in aggregate for Healthy People 2020's leading health indicators. 54% of the LHIs either met or exceeded their target or improved over the decade. This is similar to overall progress. But looking at the green category, only about 19% of the LHIs met or exceeded the target. For the initiative as a whole, about 34% fell into this green category. About a third showed little or no detectable change, and 15% of the LHIs got worse over the decade. So that's a peek at the end of decade snapshot. And next I'll turn to the progress table. An important innovation we made in moving from the mid-course and to the final review was the release of searchable online content, beginning with the Healthy People 2020 final review progress table. It's a customizable web-based tool with tables and pie charts, and it allows data users to view final progress status for the total population and for the 985 trackable objectives that we use to assess progress. This table also includes information on all the objectives, that is for the measurable objectives and for informational objectives as well. This product allows you to filter by topic area, key term, or final progress status. Final progress for Healthy People 2020 objectives was generally measured using the latest data available as of January 2020. Next slide. The next slide is a screenshot of the Healthy People 2020 progress table and pie chart online tool. Interactive selection menus can be used to display progress graphics for one or more topic areas or by key terms of interest. The pie chart shows the final progress, on the right, shows the final progress for the 4 progress categories. The data table at the bottom of the display shows detailed information about the selected objectives. It shows a symbol on the left representing final progress. Moving to the right, you see baseline, final, and target values used for assessing progress. Next, the magnitude of movement toward or away from the target value, and then whether that movement was statistically significant for those objectives for which statistical significance could be assessed. Next slide. Several topic areas showed notable success in meeting Healthy People 2020 targets for their objectives. For example, about 88% of objectives in the occupational safety and health topic area either met or exceeded their targets. In contrast, other topic areas had a high percentage of objectives that demonstrated little or no change or got worse. For example, 61% of the family planning objectives had little or no change, and 46% of the mental health objectives got worse over the Healthy People 2020 tracking period. Now, data users can explore multiple topic areas, as you see here, as well as the specific objectives within each topic area so that you can better understand what might be driving or impeding progress in a given area. Next slide. The second online product released as part of the Healthy People 2020 final review is the Progress by Population Group Analysis. This product focuses on 6 population characteristics: sex, race and ethnicity, education attainment, family income, disability status, and geographic location. Within each of these characteristics, progress was assessed for individual subgroups for which data were available. The population group analysis included 611 trackable objectives that had such population-level data. Next slide. This next slide shows an example of the Progress by Population Group online tool. The interactive selection menus are at the top, and they can be used to select the data of interest. You can also see the bar chart showing the percent distribution of progress categories for individual population groups. Now, Healthy People targets are set for the total population and not for specific subgroups. However, it can be useful to look at subgroups to see their position relative to the targets for the total population. In this example, we're looking at progress status for trackable objectives by sex. The percent of objectives that met or exceeded the target, the green category, was slightly higher among females compared to males. In contrast, the sex-specific distributions were similar with respect to the categories of little or no detectable change and got worse. Next slide. Next, I'll turn to the third component of the Healthy People 2020 final review, which is the Foundation Health Measures. Foundation health measures are global summary measures used to monitor improvement in population health in the broadest sense. These measures have been a cornerstone of Healthy People 2020 as they reflect the impact of actions and interventions implemented to achieve the Healthy People 2020 targets and goals. Next slide. Like our other products, the Foundation Health Measures product is an online tool. Data users can select from the 14 measures, select from the population group menu, and select years. Results can be displayed as bar charts, line graphs, or data tables. This is a screenshot of a trend line for Foundation Health Measure 2.3, which is healthy life expectancy in years at age 65 in good or better health. Trend lines are for the total population and for males and females. Next slide. The final component of the Healthy People 2020 final review is the overview of health disparities. An overarching goal of Healthy People 2020 is to achieve health equity, eliminate disparities, and improve the health of all groups. This product is one way we can examine progress relative to this overarching goal. It includes the interactive chart and table showing how disparities have changed over time during the decade for the subset of measurable objectives with population-based data. 6 population characteristics are included, as shown here on the slide. And for objectives included in this analysis, changes in disparities were categorized as either decreasing, increasing, or showing little or no detectable change across the tracking period. The Healthy People 2020 final review website includes detailed technical notes and a publication with information on how these calculations were conducted. Next slide. This slide shows an example of the overview of health disparities online product. As is the case for other final review products, the data can be filtered by topic area and the 6 population characteristics categories. This chart shows changes in disparities by population characteristics for all applicable objectives. That is, trackable population-based objectives for which data are available. For all 6 population characteristics, the vast majority of objectives in the analysis showed little or no detectable change in disparities over the decade. This finding is consistent with similar disparities analyses done for Healthy People 2010. Next slide. The overview of health disparities product presents data aggregated at the topic area level. However, data users that wish to take a closer look can download disparities data for the individual objectives from the Healthy People 2020 Final Review website. This is an example of the type of objective-specific disparities analysis that is available. This is an example of an objective where disparities decreased over the decade. On the left-hand chart, you see data at baseline, and on the right, data in the final year. The group with the best rate or lowest HIV mortality rate is Asian or Pacific Islanders, and we compare that to the average rate for all of the other groups by calculating the summary rate ratio. The two charts show that at the beginning of the Healthy People 2020 tracking period, the summary rate ratio for race ethnicity was 13.9. By the end of the decade, it had lowered to 7.9, and this is about a 43% decrease in the racial ethnic disparity for HIV mortality rates over time. The NCHS staff are working on a publication that further explores progress on disparities elimination, and that will be available later this year. Next slide. In closing, we've moved into Healthy People 2030, the new initiative. However, there's still important information about progress and progress on disparities over the last decade that can inform our work going forward. You can access this information in several ways. At the bottom of the Healthy People 2030 website is a link to the archived Healthy People 2020 website. There you'll find Data 2020, which is the database containing all of the Healthy People 2020 tracking data, and the Healthy People 2020 Health Disparities tool, which will ensure that users have access to progress and disparities data for historical comparisons. Statistical and data-related resources that I described today are available on the NCHS Healthy People website, and they include the Healthy People 2020 mid-course and final review products that I talked about today, and documentation and publication on methodological and statistical issues and technical details about the calculations. Last slide. I'd like to thank you for your attention and thank the many people who work on this initiative to improve the nation's health. And so now I'll hand it over to Carter.
Great, thank you, Irma. So in the next few minutes, I'll build the bridge from last decade's initiative, Healthy People 2020, to where we are today with Healthy People 2030. So building on knowledge gained over the last 4 decades, Healthy People continues to set national objectives to address our most critical national public health priorities. So this decade, Healthy People 2030 has reduced the number of objectives to provide a more focused, evidence-based, and statistically rigorous set of objectives. So Healthy People's website offers robust tools and resources to help individuals, organizations, and communities act on these priorities throughout the decade, moving us closer to our Healthy People 2030 targets. So next slide, please. So over a period of about 4 years, the U.S. Department of Health and Human Services developed Healthy People 2030 with important partners, including the Secretary's Advisory Committee of 13 external experts, federal Healthy People partners, and perhaps most importantly, input from the public. So this slide displays the Healthy People 2030 framework, its vision, mission, and overarching goals. So with this decade, Healthy People 2030 expands beyond health promotion and disease prevention to the broader purpose of promoting health and well-being. So well-being is referenced throughout the Healthy People 2030 framework and is the specific focus of the first overarching goal that you see there on the right-hand side of the screen. And then it's also referenced in the 4 other goals. So in addition, the framework emphasizes the need to achieve health equity, eliminate disparities, and attain health literacy. And it expands the concept of social determinants of health to include economic environments, as well as social and physical environments that promote health and well-being. So with its fifth overarching goal, the framework also recognizes the importance of engaging multiple sectors to take action if we're actually to improve health and well-being. So next slide, please. So for this decade, more than a dozen work groups of subject matter experts with diverse backgrounds worked to develop Healthy People 2030's approach and set of measurable objectives for Healthy People 2030 that are related to SDOH. And the social determinants of health were a central component of Healthy People 2020, but over time, the impact of the social determinants has become even more clear. And the fact is that the conditions in the environments with people are born, live, learn, work, play, worship, and age significantly influence their health. So that's why Healthy People 2030 continues its focus. Then differing from the past decade, the Healthy People 2030 SDOH objectives that were developed by all those subject matter experts also have 10-year targets. In Healthy People 2020, the SDOH objectives were what we called informational, meaning that there was no target set, but we've been bolder this decade by actually assigning targets to each of the specific Healthy People SDOH objectives. So you can learn more about our focus on SDOH and review resources like our SDOH literature summaries by visiting the Healthy People website. So next slide, please. So consistent with previous decades, Healthy People 2030 highlights a set of high priority health issues through the leading health indicators. Healthy People 2030, I think my slides got off too. Okay, I'm back. Sorry about that. So this slide displays the key elements of the Healthy People objectives. So Healthy People is comprised of its objectives, leading health indicators, and overall health and well-being measures. It shows the relationship between those various elements. So drawing on user input, calling for a more comprehensive yet streamlined set of objectives, Healthy People 2030 includes a significantly reduced number of measurable objectives that are balanced and focused on national actionable priorities. So this decade reflects a nearly 75% reduction in the number of measurable objectives compared to Healthy People 2020. The Healthy People 2030 offers three types of objectives. There's the core or measurable objectives that are associated with targets and evidence-based interventions and reflect high priority public health issues. So most of Healthy People 2030's objectives are in fact core objectives, and currently we have 355 core objectives. Then over the course of the decade, core objectives will be monitored and tracked to measure progress, and data will be provided for at least 3 time periods throughout the decade. So we also have developmental objectives, which represent high priority public health issues that are associated with evidence-based interventions, but they lack reliable baseline data and an approved data source. So currently we have some 114 developmental objectives. Then lastly, we have the research objectives, which are a new category of objectives for this decade. They represent public health issues with a high health or economic burden or significant disparities between population groups, but they aren't yet associated with evidence-based intervention. So these objectives may reflect new or emerging issues and represent significant opportunities for advancement in building a stronger evidence base where one is needed. So currently we have 40 research objectives. But I'll note that throughout the decade, as evidence and critical issues emerge, new objectives may be added to Healthy People 2030. So next slide. Great. So consistent with previous decades, Healthy People 2030 continues to highlight a set of high priority health issues through what we call the leading health indicators. So Healthy People 2030 includes 23 leading health indicators, and the organizational framework depicted in this graphic shown on the screen right now reflects the different priorities of each life stage and addresses cross-cutting issues. So this decade, the leading health indicators were chosen using a more rigorous set of selection criteria and data requirements compared to previous decades. This includes a more focused upstream of measures like risk factors and behaviors instead of disease outcomes. They address issues of national importance and high priority public health issues that have a major impact on health outcomes. And then the objectives selected to be LHIs are modifiable in the short term. So additionally, the leading health indicators were selected because of their influence on the social determinants of health, health disparities, and health equity. And they have regular data updates available preferably on an annual basis. So next slide, please. The summary measures continue to be a component of the Healthy People Initiative. So with Healthy People 2030, we've named what had been called the foundation health measures in Healthy People 2020, and which Dr. Respi described for us. We've renamed those to the overall health and well-being measures. So the overall health and well-being measures are 8 broad global outcome measures intended to provide an overall assessment of the health of the population, evaluate progress toward achieving the Healthy People vision, and summarize the overall impact of the individual Healthy People 2030 objectives, as well as other aspects of health and well-being. So the overall health and well-being measures are organized into 3 tiers. It's well-being, healthy life expectancy, and summary mortality and health. So while the leading health indicators were selected from the pool of Healthy People 2030 core objectives, the overall health and well-being measures are not Healthy People objectives, and as such, they do not have targets. So next slide, please. So we're looking forward to featuring states, communities, and organizations working to achieve the Healthy People 30 targets. So I encourage you to visit Healthy People's website to learn more about how Healthy People can be used to identify needs and priority populations, and to use Healthy People as a benchmark to monitor progress, find inspiration and practical tools, and other uses. So I invite you to join us over the decade on this Healthy People 2030 webinar series to learn about efforts of community-based organizations, educational institutions, government agencies, and others to improve specific health outcomes, address health disparities, and more. So next slide, please. So Dr. Respi's presentation highlighted the Healthy People 2020 final review and how these findings can be used to identify successes and areas for improvement. So transitioning to the 2030 decade, we've tried to support users that are leveraging findings from the previous decade to continue work on key public health priorities in other areas. So to help you continue your work in the new decade, we've created a tool that labels each Healthy People 2020 objective as retained, and this means the objective has data that can be compared across decades, or as modified, or related, or removed. And it directs you to any similar objectives in Healthy People 2030. So next slide, please. The Office of Disease Prevention and Health Promotion intends to continue many of the implementation strategies from Healthy People 2020, including webinars, progress reports, infographics, blogs, stories from communities striving to achieve Healthy People targets and goals. And these are what we have labeled on this slide as Healthy People in Action, and communication with Healthy People users through different modes. So additionally, we'll employ new implementation strategies such as more robust data visualization, more frequent data reporting. Communities, states, and many other organizations across the country use Healthy People in various ways to improve health. And we continue to learn more about the programs, interventions, and policies that help move us closer to achieving Healthy People 2030 targets and goals through our Healthy People Champions program. So we encourage you to visit our website to learn more. So next slide, please. Great. So this webinar series is part of our implementation strategy, and I encourage you to complete the poll at the close of the webinar so that we can continue to build on and improve our Healthy People products. So our webinar series will provide accurate, timely, and accessible data that can drive action, provide tools for the public, program managers, policymakers, and others to implement action toward improving health and well-being, and will share and support the implementation of evidence-based programs and policies that are replicable, scalable, and sustainable. Then over the decade, we'll review data and information related to all of our key elements. That's the leading health indicators, overall health and well-being measures, Healthy People 2030 objectives, new and emerging issues, and specific issues of national importance, including health equity and disparities. So I encourage you to stay informed by joining the Healthy People listserv to learn more about the dates and themes of upcoming webinars. And with that concludes my remarks and our formal presentation. So now we're at the point where we would love to hear from the audience. So please continue to submit any questions you may have for our presenters. And let's see, I see we have several questions that have come up already. So the first question I'll throw out to get things going is to Dr. Moyer. So Dr. Moyer, you mentioned that NCHS is one of several statistical agencies in the government and the only principal statistical agency at HHS. So can you tell us about how NCHS works with these other agencies and how this work benefits healthy people?
Thank you. Thank you very much, Carter. So Healthy People uses data sources from across the federal government to track progress on the Healthy People objectives. And these data sources, they range from, let's say, the Census Bureau, where we track the data on information around mass transit use, for example, to the Department of Education, where we track data around math and reading proficiency. And as the decade progresses, we'll use these data sources as well as add new data sources to provide additional information, such as subnational breakouts whenever possible. And I should also add, the federal statistical agencies are becoming even more connected as a result of the Evidence-Based Policymaking Act that was enacted back in 2018. The act modernizes the federal government's data management, evidence building, statistical efficiency, and really makes it possible to better use government data for policy decisions. And the statistical agencies are focused on efforts to better access, share, link, and protect data across the entire federal statistical system. So all this obviously is going to improve data availability, quality, and utility, and will directly benefit the Healthy People initiative. So thanks, and back to you, Carter.
Great, thank you. And Dr. Moyer, your answer actually provided an answer to several other questions about data that have come in. with a huge flurry in the last couple of minutes. So, Irma, I'm going to turn to you next. We have a question about the end of decade report you gave on the LHI. So can you say more about the 15% of the LHIs that got worse?
Yes, I can. So there are 4 LHIs that fell into this category. 2 of them are from the mental health and mental disorders topic area, and they are reduce the suicide rate and reduce the proportion of adolescents aged 12 to 17 who experience major depressive episodes. Unfortunately, over the decades, suicides increased 24% over the decade, and major depressive episodes among adolescents 12 to 17 increased 74%. The third of the 4 LHIs that got worse during the decade is from the injury and violence prevention topic area, and that's IVP 1.1, to reduce fatal injuries. They increased about 20% over the decade. And the 4th LHI that got worse during the decade is in the nutrition and weight status topic area, reduce the proportion of adults with obesity, where there was a 14% increase over the past decade. These objectives will continue to be tracked in Healthy People 2030, but there is one exception. The objective on adolescents with major depressive episodes is changed for 2030 to reflect a greater emphasis on upstream interventions that can move the needle. The 2030 objective is to increase the proportion of adolescents with major depressive episodes who receive treatment within 12 months. So Carter talked earlier about how you can explore the LHIs and other Healthy People 2030 objectives, including that crosswalk between the 2 iterations of Healthy People.
Great, thank you, Irma. And I see one that I'll take. It's has to do with our approach to reducing the number of objectives in Healthy People 2030 compared to last decade. So the question is, how did we make that decision to reduce, and how did we do that? So as I mentioned, we have about 75% reduction in Healthy People 2030 objectives compared to the last decade. And this was done for a few reasons, but perhaps the most powerful reason was that we heard from our users, people in the field, that Healthy People, which had grown from about 200 objectives in its first iteration of objectives released in 1980 to over 1,300 with Healthy People 2030. And I think people began to feel that was too unwieldy. And even though we've told our users that there's absolutely no expectation that any one organization, group, etc., would tackle all 1,300 objectives, I think it became difficult for people to hone in on specific objectives that were important. So it was not an easy task, but we did ask the subject matter experts within the federal government who managed all the objectives to select the ones that rose to the top that they felt were the most critical in reducing the health, disease, and economic burden connected with health status. And after that, we did several rounds and ended up eventually with about 355. And of course, there were multiple public comment periods associated with that. But what we've tried to do with this new approach is provide links to other important areas. So one objective may represent many different important areas. So I hope that answers that question. Then I have a question actually for Rear Admiral Reed here, if you are ready to take one. And it has to do with leveraging Healthy People resources to improve health and communities. So can you speak, Admiral Reed, to what are some of the available tools and resources
Sure.
public can use? Thank you.
Yeah, thanks, Carter. So I'm happy to speak about those resources on the website for Healthy People. Healthy People 2030, as you alluded to on one of your slides, Carter, has many different types of resources that can support folks' work, apart from the initiative's objective data and disparities data. As an example, on our website, we have the Tools for Action tab, which I believe you mentioned, which features several resources, including the blog series entitled Healthy People in Action, which offers stories featuring partners and communities nationwide that are moving toward achieving healthy people goals and objectives. Also, there's a section dedicated to evidence-based resources, which provides published reviews of studies and interventions to improve health. Those evidence-based resources offered on Healthy People 2030 are organized by health condition, health behavior, population groups, settings and systems, and the social determinants of health. Website users can explore topic areas of interest and examine the evidence-based resources for those that are relevant to whatever their particular focus areas are. I should point out that we'll continue to develop additional resources throughout the Healthy People 2030 decade as we move forward. So we encourage folks to keep checking back to the website frequently as those updates may occur.
Great, thank you for that answer. And back to NCHS, and I'll throw this out to both Irma and Brian. We have many questions about data and Healthy People 2030, and I'll throw some out and you two can collectively answer them. So questions address, how can new data sources be considered for healthy people? How often are data collected? And what's the determining factor in the population groups that we collect data for? So Brian or Irma, if you'd like to answer those questions, that would be great.
Oh, yes, sure. I can take a crack at it. So I guess part of the question was about how do we incorporate new data sources, and I think the priority will be certainly to provide the best data possible on the objectives that have been identified as the highest priority. So there have been times over the history of Healthy People where a data source changes because better data are available. This decade, as part of the selection process, we developed criteria related to the selection of objectives, but we also developed criteria related to the data sources. And an important part of that was to respond to the desire to be able to track progress over time. In other words, you need multiple measures over time. And so the Federal Advisory Committee that advised the Secretary on Healthy People 2030 set as a priority the availability of multiple points in time so that we can begin to look not just at data in a single point in time, but over time. So that's one aspect. I think I do kind of have to speak to the effect of the pandemic on measurement, because the pandemic impacted our lives in many, many ways, but it also affected the data that we are able to collect and report. In some cases, surveys had to pause or change data collection. In other cases, survey items had to be added to capture new and emerging needs. And so as the data, probably more so than even in the past decade, we will be reviewing the data sources that have been proposed for when they're providing data, when new data items come available that support some of those developmental objectives that the prior question asked about. And so we'll be sort of on an ongoing basis looking at data sources and trying to build them into Healthy People 2030 and to display those data on a rolling basis as they become available, because as Brian talked about in his part of the presentation, we've done a lot of work to try to improve the timeliness of data getting put up on the Healthy People site.
Great, thank you. Brian, do you have anything you'd like to add?
I guess I would just add one additional thing, and that is to emphasize how important social determinants of health are going to be in Healthy People 2030, and to emphasize how we are going to really work hard to expand that that data linkage program that we have at NCHS, sort of connecting the data, the traditional survey data that we have at NCHS with other data, administrative data, as well as other data across the federal government. Again, partly in response to the Evidence-Based Policymaking Act, but being able to better understand that intersection between, for example, housing and health, or economics and health, and really trying to bring those data in once those linkages have been made and we have a better understanding of the social determinants of health.
Great, thank you. There's a question here that I'll tackle. It's how can we track the status of Healthy People 2030 objectives with targets that are designated as developmental and research? So I'll clarify that. First, by saying developmental or research objectives do not have targets. So if an objective in Healthy People 2030 has a target, it's considered one of those core objectives or those measurable objectives, of which we have 355 right now. The developmental objectives and research objectives are intended to spur investigation and work to either identifying a data source, if the objective is developmental, and in the case of research objectives, building that evidence base for whatever the area is to demonstrate that particular area does have a significant impact on health status. So that's that question. An answer to another question is, where does prevention of unintentional injury fit into the objectives? So we do have objectives on unintentional injury, and I think you may be thinking of our IVP, Injury and Violence Prevention topic area. And those, if you were to go to the web page and go to, for Healthy People, the homepage, and search objectives by topic, you could find some of those objectives. Then moving back to NCHS. So health equity is an important topic for the entire country these days, and particularly with some of the executive orders we have within the federal government. So Irma, can you tell us how Healthy People addresses health equity?
Yes, and Brian, if you have anything that you would like to also share, we could tag team it. I want to start by saying that health equity is a cornerstone of Healthy People. In fact, I think Carter presented the goal, or I guess maybe Paul presented the overarching goal of achieving health equity and eliminating health disparities is part of the initiative. And we know that social determinants affect segments of the population in disproportionate ways. So the Healthy People 2020 framework outlines key objectives, and within Healthy People 2030, as Carter mentioned, these objectives have targets. So we monitor the effect of health of social determinants by measuring disparities for the measures with population level data. So then we begin to see the effect of SDOH on populations. We also address disparities by comparing subgroups to see the relative progress or the relative distribution of progress by comparing, for example, the group with the most favorable rate to all others. And that's what I presented in the summary rate ratio slide, and also what you can find in the Healthy People 2020 disparities tool. So for 2030, we're building on the success of our 2020 tool, and so we'll be releasing the disparities tool for Healthy People 2030 later this year. And then finally, we include disparities assessment in all of our major products. So for Healthy People 2020, that was the mid-course and final review, as well as in webinars, website tools, and statistical reports. And as I mentioned, we'll have a statistical note that will highlight disparities methods used in Healthy People 2030. And this year, we're doing a lot of very exciting planning at the interagency level for how we will present information from Healthy People 2030. And so I think health equity you'll see as a theme and parts of our themes that we'll cover in this webinar series.
So Brian, if you have anything to add, or Paul, you'll have the last word.
I could just add quickly that I think we're sort of circling back to the COVID-19 experience. I think one of the things that we're seeing is the need for more timely data and more granular data and data on subpopulations. And I think that's what's falling out of this data modernization initiative, is a focus on those types of data and making them more available. And so I think really what we're going to see is a much greater understanding of health equity issues, because we'll have the data to actually delve more deeply into those issues and better understand them than we perhaps have in the past.
Brian, I really appreciate you making that remark. I'll just follow behind and say, yeah, the more hyperlocal we look for the relevant data, in other words, better understanding and assessing the situations, the environments in which people live, is what's going to help us best understand where those inequities lie and how best to apply resources against them.
Great, thank you. And Paul, that just answered some other questions. So thank you for providing that information. So with that, we are past the time. So I'd like to thank everyone for joining us and invite you to sign up for our email list on healthypeople.gov, and hope to have you join us in future webinars. So thank you.
This does conclude today's presentation. You may now disconnect your lines and have a great rest of your day.